Gastric ultrasound can help identify the presence of solid or liquid contents in the stomach, guiding the choice of the safest anesthesia induction technique. In this video, Dr. Frederick Paulus, the NYSORA's fellow, will demonstrate the use of gastric ultrasound in an actual patient with a history of delayed gastric emptying. And if you are serious about learning POCUS ultrasound, NYSORA's POCUS app is the most widely used learning tool that features the most clinically applicable POCUS techniques. Download yours for a free test drive at the link below. Let's see the video.
So here we have a patient with a type 1 diabetes and a confirmed diabetic gastroparesis to see if we can safely administer perioperative sedation for the block. We're going to check if his stomach is empty. We're going to do this in supine position for starters. We use the curvilinear probe on abdominal settings, about 10 to 15 centimeters deep. Put the probe in the midline, just below the xiphoid. What we see is a beautiful image of the aorta, debranchment of the superior mesenteric artery, antrum of the stomach, and liver. What you want to, this is actually the image you want to see, is at least the cross-section of the aorta. If possible, visualize also the superior mesenteric artery. This is not always feasible. This is the antrum of the stomach, in which we see a very thick muscularis, round-shaped, no artifacts, no hypoechoic shadow, which means that the antrum is at this point empty. You have to determine if it's either empty, filled with fluids, or with solid contents. If it's solid contents, it's a no-go. If it's filled with fluids, and you have to determine the volume, which we'll discuss later. If it's empty, it's safe. Now we have the findings of an empty antrum of the stomach. This means you always have to proceed an investigation in the right lateral decubitus. This way, due to gravity, fluids or other contents will flow to the gastric antrum, and this will give you a second evaluation of safety. Same approach, midline, subxiphoid. At this point, it's more difficult to visualize the superior mesenteric artery, yet we have a good view of the liver, the antrum of the stomach, in which we see now that the muscularis is thinner and there is fluids inside the stomach. Then an important differentiation is the volume, which you include the muscularis. You can do this either with the elliptical shape or trace it, whatever your ultrasound allows you to do. But most of the time the antrum is elliptical shaped, so this will give you the correct measurements. So this is about 10 to 9.5 to 10. We'll do a second measurement. So yeah, between around 9.5 to 10 square centimeters. We now have to correlate this with age to find the gastric contents, to which there are standardized tables that have determined the cross-sectional area of the antrum means in volume. So we look, patient age is 56 years old. We have 9.5 square centimeters cross-sectional area in right lateral decubitus. So this means that patient is just below the safe threshold for to be considered fasted.
And that was it, the practical application of gastric ultrasound. Gastric ultrasound can provide a more accurate assessment of gastric content and volume than the traditional fasting guidelines that are based on time intervals, because individual variations in gastric emptying means that not all patients will have an empty stomach after the specified fasting period. I hope you liked the video, and if you do, be sure to subscribe to our channel and never miss the future ones. Until next time.